right, so today we want to go over the proper protocol for treating neuropathy with the PulseWave machine. PulseWave machine is basically a high-powered ultrasound machine. And so what we're going to do with neuropathy, most people have their symptoms on the balls of their feet, and we want to concentrate the shock wave right here and spend most of our time on the pad of the foot right here for most patients. Some will have symptoms in the heel there as well and in the arch, but for the most part it's going to be around this area. Okay? So the first thing we got to do is program this. So we want to have it at 15 hertz, and we want 1500 pulses per foot, and we're going to start about 1.1 and we're going to go up to 2.6 is the maximum. Actually, the best therapeutic level is 2.6 right there. The best way to apply the gel is with the tongue depressor. It's less messy, and we're going to go cover the area that you want to treat. And don't be stingy with it, because that's what applies the shock waves. Transmits the sound wave. Okay, good. So with this is set to start automatically with pressure setting. So it's you don't have to hit the button, it's all preset. If you don't know how to do that, ask Jerry, he'll show you how to set it up. So what's really important when you're doing this, you need counter pressure by your other hand. So you want the pulse wave perpendicular to the foot, and then you want your hand on the opposite, pushing the opposite direction. This helps it make it more comfortable for the patient. And then you want to tell the patient before they start that this is going to be uncomfortable, and but it shouldn't be super painful. So on a scale of 0 to 10, 10 is your worst pain, and 0 is no pain. This shouldn't be more than a 6. Let me know if it's worse than a 6, okay? So we're going to start. You all right? So you just hold it here. You're not massaging. You hold it in the area, and you move it to each area. Like that. And that was short of time. We did 364 beats. We want to do 1,500 beats a foot. But if you see it, I had counter pressure right here, and I was just using the shaft of the gun. You don't hold it like a gun. You know, don't hold it like this. Make sure you hold it like this. And then if you have it set correctly, it's going to turn on and off automatically with pressure. So just like this. One of the problems that you can have too is if you don't put enough pressure, if it's too light and it starts making a high-pitched sound, that's going to feel actually less comfortable for the patient. It's going to be like a snapping rubber band. So you want to make sure you have adequate pressure. Just like that, over each spot. And that's pretty much it. You're going to do 1,500 beats on this foot and then the other foot right there, and just move the different areas. Now, ultimately, your guide with this, with neuropathy, they're going to have numbness. There's not going to be usually not pinpoint pain. If there is any pinpoint pain, put some focus on that area too. Okay, great. And you want to use the widest head. There's 3 different heads with your shock wave. You want to use the widest one because it makes it more comfortable. Okay. Good. Oh, frequency. You want to do this not more than once a week. Shock with PulseWave, you need a week for the body to respond. What PulseWave is doing, it's stimulating the body's healing processes. It's doing basically micro trauma to the area, and that turns the body on to like, hey, we need to go heal this. And so what you're going to get is stem cell migration of their own stem cells or the ones you put in the body, and you're going to get growth factors, and you're going to also cause angiogenesis. So you're going to see increased circulation in that area immediately after the treatment and then ongoing, because it's going to stimulate new blood vessels.